Every week, thousands of older adults deal with stool that feels stuck right at the exit. And for some older adults, it can become serious enough to require emergency care. If it feels like your stool is stuck right there but simply won't come out, don't do what most people instinctively do next. Don't push harder. For many people over 60, that instinct is exactly what makes things worse. Instead, I'm going to walk you through a ranked list of methods that actually work, starting with the gentler options and building up to the one many colorectal surgeons reach for first. Stick around because the last one on this list is the one that helps the most people the fastest. But before we get to the list, let's understand what's happening inside and why some approaches work while others just make things worse. As food moves through the colon, water is gradually absorbed from it. Normally, this process is balanced, and stool comes out reasonably soft. But if stool sits in the rectum too long, because of slow motility, not enough fluids, or ignored urges, too much water gets absorbed, and the stool becomes hard, almost rock-like. The surrounding muscles get tired, and the rectum itself stretches out and becomes less sensitive to the "it's time" signal. After age 55, this happens noticeably more often for several reasons. First, bowel motility naturally slows with age. Second, many people this age take medications that slow the gut as a side effect. Iron supplements, certain painkillers, calcium channel blocker blood pressure medications, and a number of antidepressants. Third, the sense of thirst declines with age, so people drink less water without even noticing. And finally, physical activity decreases, and movement directly stimulates bowel movement. Put it all together, and you get a vicious cycle. Less water and movement leads to harder stool, which makes using the bathroom harder and more painful, which makes a person unconsciously delay going, which makes the stool even harder. That's why it's important to break this cycle with several methods at once, not just one. By the way, we're aiming for 200,000 subscribers this month. If this channel helps you, subscribe now. It only takes 2 seconds. Let's continue. There's one thing here that often confuses people. If, on top of this kind of blockage, something resembling diarrhea suddenly appears, that doesn't always mean the problem has resolved on its own. Sometimes the liquid part of the stool simply leaks around a hard plug that's still stuck in place. Doctors call this paradoxical diarrhea. If the feeling of fullness in the lower abdomen hasn't gone away after the diarrhea, that's a sign the blockage is probably still there. In this situation, many people first reach for a regular laxative and get frustrated when it doesn't work. The reason is simple. Most stimulant laxatives make the entire colon contract, pushing contents forward. But if the problem is specifically at the very end of the path, in the rectum, where the stool is already compacted and hardened, pushing from above often just doesn't get the job done. It's like trying to push a cork out by squeezing the side of the bottle instead of the cork itself. Fiber is tricky here too. Normally, it's your friend. But if you sharply increase your fiber intake without enough water, the volume of stool increases while the hard core at the bottom stays put. And things only get harder. That's why, when the blockage is specifically in the rectum, locally acting remedies tend to help more. Now let's rank the options, from the gentler supporting habits up to the one that gives the most reliable relief. Number 7. Warm water and proper hydration. Right after waking up, before breakfast, drink a glass of warm, almost hot water. The heat stimulates what's called the gastrocolic reflex, a natural signal for the bowel to start moving as soon as something enters the stomach. Throughout the day, aim for roughly 1.5 to 2 liters of fluid, unless your doctor has restricted your fluid intake for other reasons, such as heart or kidney failure. Use urine color as your guide. It should be pale yellow, not dark. Coffee and alcohol don't count as proper hydration since they have a diuretic effect and can actually worsen dehydration. This one's a foundation. It supports every other method on this list, but on its own, it's usually too slow to bring relief today. Number 6, the right toilet posture. This is free and often works almost immediately as a supporting technique. Put a low stool or a stack of books about 6 to 8 inches high under your feet so your knees end up higher than your hips, and lean forward slightly, resting your elbows on your knees. This straightens out the angle between the rectum and the anal canal. In a normal seated position, that angle is bent like a kink in a hose. Research on pelvic floor physiology shows that this squatting position reduces the effort needed for a bowel movement and reduces straining. Now we're getting into the methods that tend to work much faster. Number 5, breathing instead of straining. Straining hard is tempting, but it's often exactly what makes things worse, especially after 55. Hard straining involves holding your breath and sharply raising pressure in the chest and abdomen. This is called the Valsalva maneuver, and for people with heart problems or high blood pressure, it can be unsafe. Instead, try a slow inhale, then on the exhale, gently, without sudden force, push using your abdominal muscles as if blowing air out through pursed lips. Several gentle exhale pushes are often more effective than one powerful but unsafe strain. Number 4, the I love you abdominal massage. With warm hands, massage your abdomen, starting at the lower right, moving up toward the ribs, then across to the left, and down to the lower left, following the direction contents move through the colon. Light circular motions for 5 to 10 minutes, ideally first thing in the morning or 20 to 30 minutes after eating. Many people find that doing this regularly improves bowel regularity over time. Everything from this point on works directly where the problem is. Number 3, the teaspoon of olive oil and lemon. This is the home remedy mentioned in the title. The recipe: 1 teaspoon of extra virgin olive oil mixed with the juice of half a lemon in a glass of warm water taken on an empty stomach in the morning. Some people find this helpful, although scientific evidence is limited. The working theory is that the oil provides some lubrication, while the lemon's acidity gently stimulates the gallbladder, which can support bowel activity. If you try it, don't expect results in seconds. When it works, it's usually within 30 minutes to an hour. If you're taking blood thinners or have gallbladder issues, check with your doctor before trying this. If the first 3 methods haven't brought enough relief, the next 2 are usually the ones people end up discussing with their pharmacist or healthcare provider. Number 2, magnesium hydroxide, better known as milk of magnesia. This is an osmotic laxative. It draws water into the bowel, softening the stool. The standard adult dose on the label is usually 1 to 2 tablespoons, but always check the specific manufacturer's instructions. The effect usually kicks in anywhere from 30 minutes to 6 hours. It's contraindicated or requires caution in people with kidney disease, and you should check with your doctor if you're taking heart medications or tetracycline antibiotics. Don't use it continuously for more than a week without a doctor's guidance. A few more tools are worth knowing before we get to the last one. Less for an emergency, more for keeping this from becoming a pattern. Stool softeners like docusate sodium don't make the bowel contract. They simply help water and fats get into the stool, softening it from the inside. They're often recommended for people after surgery, new mothers, and anyone who shouldn't strain much. The effect is usually noticeable after 1 to 3 days of regular use. Prunes and prune juice, a warm sitz bath, and a short walk after eating round things out. Prunes contain sorbitol, which gently draws water into the bowel. A 10 to 15 minute warm sitz bath relaxes pelvic floor muscles that often tense up from stress and pain. And a 15 to 20 minute walk after eating mechanically stimulates peristalsis, and often works surprisingly fast when combined with everything else here. And now, number 1, glycerin suppositories. This is often the option that helps the most people, the most reliably, and a favorite recommendation of many specialists specifically for relief that's stuck in the rectum. It acts locally, right where the problem is. It softens the stool and gently irritates the rectal wall, triggering the urge to go. The effect usually kicks in within 15 to 60 minutes. Suppositories are sold over the counter at virtually any pharmacy and are considered one of the safest options even for people with chronic conditions since they're barely absorbed into the bloodstream. Insert the suppository, lie on your left side for a few minutes to let it dissolve, and try to hold the urge for at least 15 minutes for the best effect. Now, what makes the situation worse, even though it seems logical at first? The first mistake is straining too hard. We already talked about the Valsalva maneuver. It's not only ineffective against hard stool, it's risky for your heart and blood vessels. The second is ignoring the urge to go. If you keep putting off the bathroom when your body signals it's time, the rectum gradually gets used to being stretched and responds less to the signal next time. The third is not drinking enough water while increasing fiber. If you eat more bran or fiber supplements without also increasing fluids, the stool can just become bulkier and harder, making the problem worse instead of better. The fourth is switching too abruptly to a lot of fiber. The gut needs time to adjust. Increase fiber gradually over a week or two, not all at once. The fifth is sitting on the toilet for more than 10 minutes. This increases pressure on the veins around the anus and raises the risk of hemorrhoids. The sixth is frequent or uncontrolled use of enemas and stimulant laxatives without a doctor's guidance. The bowel can get used to constant outside stimulation and work worse on its own over time. And the seventh, one rarely talked about out loud. Because the topic feels awkward, people put off talking to a doctor for months, sometimes years, trying to handle it themselves with increasingly strong remedies. The longer this goes on, the harder it becomes to fix later. Reaching out sooner is almost always easier and faster than waiting. And now, the most important part. Home remedies often bring relief, but there are situations where you shouldn't wait. Seek medical care right away if you haven't had a bowel movement in 3 or more days, despite trying the methods on this list. You develop severe or worsening abdominal pain, you start vomiting. You develop a fever. You notice blood in your stool or on the toilet paper, especially dark blood that looks like coffee grounds. Your abdomen becomes noticeably swollen and hard. You've completely stopped passing gas. This can be a sign of bowel obstruction. Or you've noticed unexplained weight loss over the past weeks or months. If the blockage is severe and home methods don't work within a day or two, a doctor or nurse can safely and professionally clear it manually in a clinical setting. This is a standard routine procedure, and there's no need to feel embarrassed about it. Don't try to do this yourself at home. And if you're over 50 and have never had a colonoscopy, this is a great reason to ask your doctor whether it's time to schedule one. So, to sum up, stool getting stuck in the rectum is unpleasant, sometimes scary, but in most cases manageable. Starting with hydration and posture, moving through breathing and massage, and, when needed, glycerin suppositories or magnesium hydroxide, most people find real relief within a day. But the real goal isn't just solving the problem today. It's making sure it comes back as rarely as possible. Build these 4 habits gradually, 1 per week. Drink water throughout the day, not just when you feel thirsty. Move at least a little every day. Don't put off going to the bathroom when your body signals it's time. Try to set aside a calm time for it, ideally 20 to 30 minutes after breakfast. And gradually add more vegetables, fruits, and whole grains to your diet. What do you think is harder? Dealing with this problem or working up the nerve to tell your doctor about it? Let me know in the comments. Your body knows how to take care of itself. It just sometimes needs a little bit of the right support. Take care of yourself, listen to your body, and don't be shy about talking to your doctor. For them, it's a completely routine part of the job. And for you, it could be the start of a much easier and calmer life.